State lawmakers were just sworn in, and they are already getting to work on an issue that has received a lot of attention over the last few years: mental health. Good evening, everyone. I'm Brian Yacono.
And I'm Amanda Hill. State Senator Joe Baldacci is proposing a bill that would work to get more money for mental health services across Maine. But they're not looking to state funds to do it. They're looking to Washington. However, not all mental health advocates are in favor of it. News Center Maine's Jackie Mundry explains why.
When the legislature gets down to business in Augusta next month, one of the first bills they'll take up will be a push to get federal funding for mental health resources.
We can't treat people and help them if we're keeping them in a hallway or at an emergency room waiting for treatment.
That's why State Senator Joe Baldacci is proposing a bill that would force the Maine Department of Health and Human Services to apply for a federal waiver that would provide funding to the state's 2 public and 2 private mental health inpatient facilities. Maine has already applied and received this waiver for substance abuse disorder, but not for serious brain disorders like bipolar and schizophrenia. Former State Senator John Nutting has been a big supporter of mental health resources like this since the early 2000s. He says we need to follow states like Washington, Florida, Illinois, and Hawaii.
We can take all of it and put it in community services like other states already have.
But not everyone is in favor of this legislation. The Consumer Counsel System of Maine doesn't believe in forcing people into treatment, which they say is what funding this treatment program would do.
Abuse tends to happen much more frequently in institutions than they do out in the community and people's homes.
Baldacci says this bill is still being reviewed, but will likely go before committee in late January or early February. Jackie Mundry, News Center, Maine.